back to Drugs Decode. Let's test your clinical skills with 10 high-yield pharmacology case questions on the nervous system. Listen to question, pause the video, answer it, then check and get explanation. Here, I'm also going to check your concentration power. I am not going to give whole question. Instead, I will give the key points. So please carefully listen to case scenario. Question 1. A 45-year-old man with a history of major depressive disorder presents with insomnia and low appetite. His psychiatrist decides to prescribe an antidepressant that can help him gain weight and sleep better. Which drug is most appropriate? Correct answer is C, mirtazapine. It's an antidepressant that causes sedation and weight gain, making it ideal when sleep/appetite are issues. Let's see other choices. Sertraline is SSRI, can cause insomnia and weight loss. Bupropion increases risk of insomnia. Fluoxetine has long half-life, activating appetite suppression. Question 2. A patient taking phenytoin for seizure control presents with complaints of gums swelling and overgrowth. What is the most likely cause? Correct answer is C, phenytoin-induced gingival hyperplasia. It's a classic side effect of long-term phenytoin use. Question 3. A 70-year-old patient with Alzheimer's disease is prescribed donepezil. What is the mechanism of action of this drug? Correct answer is D, acetylcholinesterase inhibitor. It increases acetylcholine in the CNS, which is reduced in Alzheimer's. Dopamine agonist is used in Parkinson's, not dementia. NMDA antagonist, memantine, is also used but not donepezil. Monoamine oxidase B inhibitor Parkinson's drug, like selegiline, not used here. Question 4. A 25-year-old woman experiences a severe migraine with aura. She is prescribed sumatriptan. What is a contraindication to using this medication? C. Coronary artery disease. It causes vasoconstriction, leads to risk of myocardial infarction. Asthma is not a contraindication. Epilepsy is used with caution but not absolute. Hypothyroidism is not a concern here. Question 5. A young male is treated with risperidone for schizophrenia. After a few weeks, he develops breast enlargement and galactorrhea. Which mechanism explains this side effect? Correct answer is D, dopamine receptor blockade, which increases the prolactin level. So, above symptoms were raised. Let's see other choices. Dopamine stimulation would lower the prolactin. Alpha-1 blockade causes hypotension, not hyperprolactinemia. Serotonin activation is not the main mechanism here. Question 6. A 60-year-old man with neuropathic pain due to diabetes is started on amitriptyline. He returns with urinary retention and blurred vision. What's the most likely reason? Correct answer is C, anticholinergic side effects. Tricyclic antidepressants block muscarinic receptors, which leads to dry mouth, constipation-like symptoms. Question 7. A patient on high-dose morphine postoperatively is found unresponsive with pinpoint pupils and depressed respiration. What is the immediate treatment? Correct answer is C, naloxone. Opioid antagonist, rapidly reverses respiratory depression. Let's look other choices. Atropine is an anticholinergic, not useful here. Flumazenil is used for benzodiazepine overdose. Diazepam would worsen CNS depression. Question 8. A 50-year-old patient is started on levetiracetam for focal seizures. He later develops agitation and mood swings. What is the likely cause? Correct answer is B, levetiracetam-induced behavioral changes. It is known for causing irritability, aggression in some patients. Let's see other choices. Electrolyte imbalance is rare with levetiracetam. Currently, he is not withdrawing the drug. Refractory epilepsy would cause seizures, not mood symptoms alone. Question 9. A patient being treated for bipolar disorder complains of tremors, excessive thirst, and confusion. His serum lithium is 2.2 millimoles per liter. What is the best next step? Correct answer is C, discontinue lithium and hydrate. Because lithium greater than 2.0 millimoles per liter is toxic, and hydration helps excretion. Let's see other choices. Increased dose is dangerous, never in toxicity. Adding sodium is only relevant if hyponatremia is present. Propranolol may reduce tremor but won't treat toxicity. Question 10. A patient presents to the emergency room with confusion, hyperreflexia, myoclonus, and high fever. He's on sertraline and recently started linezolid. What is the most probable diagnosis? Correct answer is B. Serotonin Syndrome. It's caused by serotonergic drugs, SSRI plus linezolid here. Classic triad are cognitive changes, neuromuscular changes, autonomic instability. Let's see other choices. Neuroleptic malignant syndrome is caused by antipsychotics, not SSRIs. Anticholinergic toxicity causes dry skin, delirium, no clonus. Sepsis causes fever, but no myoclonus or hyperreflexia. Okay, that's all for today. Please comment your thought and doubts here. Thank you. Don't forget to like, subscribe our channel,